afterwards. Wonderful. So with that, I'm going to go ahead and introduce Shelley Parks from the San Diego Food Bank. Shelley is originally from Minnesota, and she moved to San Diego to pursue her master's in social work from SDSU. Her internship resulted in a career overseeing a food distribution program. Through operating and expanding a food pantry program, she honed her skills at capacity building. Taking that working experience to the Cushman San Diego Food Bank in 2014, she excelled at assisting nonprofit partners to increase capacity, operate impactful food programs, and maintain compliance with federal, state, and local policies. Shelley gained her licensure in clinical social work in 2015 and is most passionate about fighting hunger in the community, ensuring that all Canadians have enough good, nutritious food to thrive. Shelley is now the food senior director of programs, overseeing all of the direct and indirect service programs the food bank operates to reach more than 550,000 people across the county each month, which is pretty amazing. Shelley, I know you have some slides to share, so I'm going to turn it over to you.
All right, thanks so much for having me today. I'm super excited to be here. Prior to working at the San Diego Food Bank, I worked for Jewish Family Service, and I would run the volunteer shifts every Sunday, and Junior League would come very often to do the volunteer work there. And so I'm excited now I'm at the food bank. I've been there for 7 years, and I'm excited to share with you what we are doing, what we have done during the pandemic to meet the increased need, as well as some opportunities for Junior League to get connected with the food bank in an even deeper and more meaningful way. So I will share my slides here. And so I'm going to talk through food security in the San Diego region. And I'll start with food security and social determinants of health, which is a hot buzzword in the last maybe 5 years, the social determinants of health. Really, this has been going on for ages, right? Food affects what our health is, but not until recently did healthcare and food pantries and emergency food systems really bridge that gap and make that connection, that what we eat determines our health, and it's not just medicine and reacting to different things that we have like diabetes, hypertension, but being preventative and eating the right foods and the healthy foods. And this seems like a no-brainer, something we've always known, but it's become more enlightened within the medical field and even within the healthcare insurance providers system. So when we talk about food insecurity, you know, that's a foreign word to a lot of people outside of the field that I work in. A lot of people just call it hunger, simple hunger. But the difference is you and I are hungry every day. You know, 11:30 rolls around, I'm getting hungry for lunch. My stomach starts growling. If my husband's hungry, he might get a little hangry at me before we go out to dinner. But what food insecurity really is, as defined by the United States Department of Agriculture, or USDA, is when people don't have enough food for an active and healthy lifestyle. It alludes to that insecurity that you're feeling when you might not be able to feed your kids, your family. You might be missing work. You might have health impacts because you're not getting enough food or the right types of food that your body really needs to thrive. So in San Diego, some of the numbers here. So in 2021, this is some recent data since the pandemic, 1 in 3 people is facing hunger. Previous to the pandemic, that was about 1 in 6. But as you can imagine, for a lot of reasons that it got exacerbated during the pandemic, businesses were closing. I know my esthetician was out of service for a while. A lot of my local restaurants were closed for a while. And so everyone's feeling the economic impacts of this. We're seeing a lot of people in unions. So people that are working at Qualcomm or Petco Park or something at events, those all shut down for a lot of 2020. And then people went into arrears with their finances and are struggling to get out and under that heavy weight of all of the debt that they've incurred. So that really breaks down, and in our county, out of the 3 million people that live here, to about 600,000 food insecure adults and about 280,000 children. So the number is even higher with children than 1 in 3. So 2 in every 5 children in San Diego County is currently food insecure. And there's a lot of efforts going towards helping ensure that the children can make their food needs met, but it takes a village and it takes everyone contributing to make sure that children don't go unfed. So when we look at the poverty line and how it's broken up by ethnicity, it really greatly and disproportionately affects the African American and Hispanic populations of our community. So race does play such a factor into who is, disadvantaged sometimes at birth, and then who has just systemic racism and systemic issues built up that make it harder to access things and harder to get your needs met. So we really focus a lot on how we reach out to our Hispanic communities and our African American communities, because we know that they are underserved. And while we're open to reaching everyone, my team in the food bank is also really aware of the ages and genders and ethnicities that we are serving to make sure that we can reach the needs, knowing that these needs are higher among those populations. And with a focus on gender as well, these are our statistics from the food bank. We have a database that we use when people are picking up food, and traditionally it is the female of the household. So among those presenting at a food distribution, 68% of them are female. And so that doesn't mean the men in our community are not hungry, but the women are the ones going out to the food distributions to be picking up that food at a much higher, more than double rate than the men. And when we talk in terms of what does it really look like, right? 1 million people in San Diego are facing hunger. To give you a visual of it, we've all been to a ball game at Petco Park, and that park stadium holds 42,000 people. So if we were looking at how many people are hungry in San Diego, we would have to fill every seat in Petco Park more than 24 times over to seat everybody who's food insecure in the community. It's huge, it's astronomical, and it seems a little bit daunting at times. So I mentioned social determinants of health and why this is important. The healthcare system has put a lot of focus on this in the last 5 to 8 years. And they've really come to realize what they can do environmentally and socially can really impact people's health more than waiting to the time that they're seeing their primary care, their urgent care, or their emergency care physicians. If healthcare systems are looking at food insecurity and looking at a diabetic patient who presents to themselves, are they diabetic because of choice, or are they diabetic because they don't have access to the healthy food and the fruits and vegetables that they need to maintain a weight that they don't have diabetes, to have lower sugar and have lower processed foods? Can they access that food? So healthcares are really waking up to this, and I'm loving the change and the shift, because what we really want to do is use food as medicine and food as a preventative tool to those nutrition related diseases. And there are all sorts of social determinants of health that matter. They affect all the different areas listed on this slide. A couple I want to point out is just the availability to meet your daily needs is one of the top social determinants of health. So if you're not having safe housing or access to food, that is one of the biggest social determinants of health. But then also one that comes into play is crime, violence, and social disorder. So one of our food pantry partners said it best to me one time when she said, people in desperate times do desperate things. So when somebody doesn't have enough food to feed their families, they could potentially resort to crime, violence, or social disorder to get those food needs met. I mean, if you put yourself in that situation, if you couldn't feed your kid, you would do anything possible to meet that need. Jumping into a story here, early on in the pandemic, a lot of things were on lockdown and stay-at-home orders. This was a time when food pantries were needed more than ever. And because there wasn't a lot else going on in the community, a lot of police attention turned to the food distributions, and the police would show up at distributions and say, why are you gathering 200 people? We need to keep everyone 6 feet apart. We need to keep everyone at home, but you're here having this food distribution. And so it was a lot of conversations I had with police departments across the county, reminding them that we are at the front lines of social disorder, right? If we didn't have the free food available to the community and they didn't have income because their job was shut down or whatever was going on, that it could potentially lead to a lot of social disorders. So the police departments quickly woke up to that and saw how important our work was and really aligned with our work. They helped with traffic. We switched to different drive-through models, and the police would be out there conducting traffic for us and doing all sorts of supports because they saw the importance of what we were doing, meeting that very basic need and helping them with their jobs to prevent crime, violence, and any sort of social disorder. And the food bank kind of as a whole, it was some of the statistics, it was founded in 1977. So we have more than 40 years out there in the community. We have about 80 staff members who in the last year moved 60 million pounds of food. So seems like something insurmountable with only 80 people, but we have 35,000 volunteers every year that help us. So we could not do this without the lifeblood of our volunteers. Our volunteers way outnumber the staff at the food bank. We try and keep our staff on the forklifts and in the trucks, and the volunteers are so much of our hands-on work, both in our warehouse and out in the community distributing food. So it is not possible without the whole community's support. And we do have 2 facilities now, one in Miramar and one up in Vista. So wherever you live in the county, if you're North County or if you're Central or South Bay, there are different volunteer opportunities, hopefully in your community, that you can come out to. And then I mentioned our volunteers were such a great resource, but so are our nonprofit partners. We partner with more than 500 nonprofits in the community, churches, social service agencies, after school programs. More than 500 of them use the food bank as a source of food to run their grocery distributions or their meal programs out in the community. And it's really a true partnership. We provide such a network and a social safety net of food in the community. And this wouldn't be possible without all of the other organizations that support all of the food distribution. Something new that has happened in the last 5 years is that we formed a diaper bank as well, because food we saw was not the only need, but when we're looking at maternal health, diapers are an important resource for families too, and it's something that your food stamps or CalFresh dollars can't buy. That's restricted to food only. So how do you raise your child if you don't have diapers? We've heard some great research. It's sad research, but across the nation, there were some studies done, and just the stories behind it are heart-wrenching. We had a speaker at our last hunger conference who talked about what desperate parents do in desperate measures. And they said that sometimes there's low-income households, and when they're looking for a place to rent, one of the biggest things they're looking for is like a linoleum floor in the kitchen, because they can't afford diapers for their baby. And what they might end up doing when they run out of diapers, or all of their diapers have been used to bring the child to daycare and they have to have that stock at daycare, sometimes they'll go without diapering their child and just put them in the kitchen floor and have that work itself out. And we did not feel that was right. And families in San Diego can't be doing that, right? It's not right for the child. It's not right for the growth. So with our partner, Assemblymember Lorena Gonzalez, she really spearheaded this. And in 2017, we started as the first diaper bank in San Diego. Now we're boasting over 100 nonprofit partners who are distributing about 750,000 diapers every single month. Lorena Gonzalez was amazing and got some state funding behind this in 2018. In the amount of $10 million over 3 years to 4 food banks, and that has since expanded to more and more food banks. The 4 food banks who were mentioned in the original budget of this knew that we needed to spread further than just LA and San Francisco and in Sacramento and San Diego. We needed other food banks across the state to have some of this funding as well. So we opened it up. California Department of Social Services took over the oversight of it. And this was 3 years of funding. It was actually renewed last year, which was amazing, and a really good legislative win, that we showed success in the program over 3 years. We spread it further than the initial legislation said in those 3 years, and the funding was renewed. So we have another 3 years of diaper funding, at least from the state, and that has been an amazing resource to our community. So amazing that Lorena Gonzalez also spearheaded another bill that was passed just last year. And that amounted to $2 million over 3 years for 2 food banks. It's us and LA Regional Food Bank, who were given money for tampons and maxi pads, so period supplies. We just started this up 3 months ago in 2021. And since that time, we've distributed about 70,000 tampons and 58,000 pads, and we are going strong and growing as we continue to do that work here in the community. Lorena Gonzalez was such a champion of diapers and period supplies. So in 2019, she issued Senate Bill 92, which meant that across our state, tampons and pads and diapers were not taxed at the stores for everyone because it was seen as an essential thing like food for over 2 years. And that was a pilot. It just ended in December 2021. But through the trailer bill, when it moved from Senate to Assembly, Assembly Bill 150, this tax exemption was made permanent. So effective January 1 of this year, that's going to be a permanent thing that you and I and everyone do not have to pay tax on baby diapers, tampons, and pads into the future in the state of California. So that's a huge win for our community and the state as a whole. So I've never been busier at the food bank than the last 2 years. I've been there for 7 years, but the impacts of the pandemic, we could have never even guessed. So I want to give you a little synopsis of what our numbers are and what they maybe were before the pandemic. So February 2020, before the pandemic hit, we were serving about 350,000 people every month. We've jumped up to 600,000. And pre-pandemic, the fiscal year before that, 43 million pounds of food. And then just our last fiscal year, we hit 60 million pounds of food. So that amounts to a 82% increase in the people served and a 40% increase in the food that we're distributing. And then when it comes to our dollars, pre-pandemic, our food budget was about $2 million in purchased food. So the foods that we were not getting through donations, we had to purchase about $2 million in food. The pandemic took a huge hit on our food drives that were coming in. So typically food drives are held at schools and churches, some office buildings, but the large majority of big bulks of food drives come in through schools and churches. And in 2020, those places were remote or shut down altogether. And so when our food drives plummeted, San Diego community came in huge with a lot of financial donations instead of those in-kind donations. And so that allowed us to purchase and make up for what we were not receiving in kind donations. So last fiscal year, we spent $16 million, which was a 700% increase over previous years. Huge increase and just a shift of what we had to do during the pandemic and ask for dollars over food. Because the food was not coming in through food drives. It has been a huge shift in our procurement of food, but we've really pivoted, like a lot of businesses have, to help continue to make ends meet. We also launched 35 super pantries. So also something we saw at the beginning of the pandemic is that in our network of 500 nonprofit partners, they were speaking up saying, we can't handle this. We don't have enough volunteers. We don't have enough parking lot space. We don't have enough refrigeration and freezer space to help all these people that are coming to us, 60 to 70% more people coming to us than pre-pandemic. So what we ended up doing as a food bank is really supporting 35 of our pantries who wanted to do a lot more. We had some pass-through grant funding. In the last 2 years, we gave out $2 million in pass-through grant funding. And a lot of it was earmarked to these super pantries. So we put out an RFP, a request for proposal, and we had all of our pantries who wanted to do more, but needed the money to do more, apply for some funding with us. And we selected the top 35 so that we had good geographic coverage throughout the county. And we gave each of them at the beginning $20,000 to help them buy refrigeration, and some bought trucks, and some paid additional staff to come in. But they all got to use the money the way they needed to build their infrastructure. And then we promoted this hugely in the community, trying to get people in need of food to really focus on these 35 super pantries who had stepped up to the plate and got additional funding. We funded them for 3 rounds for 18 months now. To continue this work and to continue at this heightened level, but they've also had the finances and the infrastructure behind it to hire more staff, buy more gas, build bigger refrigeration, buy more tables, whatever it was they needed to really keep their services up boosted. And that has been able for our other, 470 partners to be able to drop their numbers a little bit and focus on these super pantries as the main place to go for food. Also during the pandemic, I remember early on going out to distributions and having to pivot them to drive-through models. So traditionally in food pantry models, people typically would park and walk up into inside a church or inside a social service agency to get their food. And that was a little crazy making at the beginning of the pandemic. We needed to keep everyone 6 feet apart. And so some places with long lines, that meant the line was maybe 2 or 3 miles long when you stretched it out with 6 feet in between every person. And so we helped our direct distributions and our partner distributions pivot to drive-through models where families could come in their car, keep the windows up, keep things safe, pop the trunk, and volunteers could pop the food right in the trunk and have that contactless service, just like we see at Target and Bonds and Albertsons. You can just come through, pop your trunk and get the foods that you need right into the trunk. The other thing that the food bank runs is a senior food program where we serve 15,000 seniors every month. And as we know, that was the most at-risk population during COVID. At the beginning, that was the most heightened awareness. And it was, if you're over 60, stay in, stay at home. And so of our 15,000 seniors who were being tasked with staying at home, but still having to get food, we needed to pop up a home delivery service. So we partnered with a local disaster group that works nationwide, but there's a branch locally called Team Rubicon. And they came into our offices and made outbound calls to 700 seniors every single day, asking them if they could make it out to the food distributions, explaining to them that they could stay in the safe bubble of their car with the windows up, pop the trunk and get food. But some of the seniors couldn't even do that. They didn't drive, their caregiver was staying safe at home. Whatever the barriers were, they couldn't make it out to the distribution. So Team Rubicon would do home deliveries for anyone who couldn't make it out to the distribution, doing about 200 home deliveries every single day for our senior population to make sure that they could get fed. As I mentioned, we've done $2 million in capacity funding to our nonprofit partners. We also had so much food that we were purchasing and moving through so much quicker, we had to rent a third facility near our warehouse in Miramar so that we had some overflow for additional food coming in. We know there has been a lot of supply chain disruptions. I know about a month ago, the cream cheese supply chain disruption affected me. Went to the store and couldn't find any cream cheese. Well, that is happening on a much huger scale at the food bank. We may be buying several semi-truckloads of food, and then suddenly we buy it from the manufacturer, and then suddenly they can't find a carrier or freight or a semi-truck to bring it to us. And so that might be delayed 6 or 8 weeks. And we knew that was happening. And that's why we bought more food at the beginning than our warehouse would even fit, because the supply chain disruptions meant that something we order and expect in 4 weeks might not come for 12 weeks or 16 weeks. So we knew we needed to just stock up and prepare for those supply chain disruptions. We are just downsizing next month and phasing out of that third facility. So we found that we've kind of hit our groove and we don't need that third facility for that extra overflow and that extra stockpile of food. We can just do it with our regular Miramar and Vista warehouses. We also had to staff up with more truck drivers and warehouse staff to help move the increased demand of food. So to talk to you a little bit about our programs and how the food goes out the door, we talk about our programs in terms of our nonprofit partners. So 500 partners, and then they also go and pick up directly at some of the grocery stores in a program we call Fresh Rescue, where we'll just want to keep the food local. So if there's a grocery store in Oceanside, we partner that grocery store up with a nonprofit in Oceanside so that they can pick the food up directly, because it doesn't make sense to move the food donations from Oceanside all the way to Vista to go back to the partner in Oceanside. So we pair that up directly with the stores and the nonprofits, and we oversee that from like a tax deductible standpoint and making sure that we're collecting pounds and reporting that out and giving the grocers their tax deductions. We also focus on seniors, and we operate more than 65 sites where we're serving 15,000 seniors every month. We focus on low-income families, individuals, as well as military population. It surprises a lot of people that we're serving about 42,000 active duty military and their dependents every single month. But we have a very high cost of living here in San Diego County. And so if a military family moves here from Virginia, the cost of living might be much lower and they don't get an increased pay just because they're living in San Diego. They just have to tighten their belts. And one way to do that is to access food from the food bank so that they can help make ends meet and pay all of their bills and pay $4.50 a gallon for gas when they're not used to that. So we serve those families and military through our emergency food assistance program, which is a federal program, our neighborhood distributions, where we go out in the community to more than 30 sites and set up free farmers market style distributions of fresh produce. And then we also have 2 teams that do CalFresh, or what was called food stamps back in the day. We help people with that application so they can get that federal benefit. And then across all of our programs, we also incorporate nutrition education because we want to not just hand out empty calories, but also focus on nutrition. We also have a target of reaching children. So we have our diaper bank sites that reach more than 100 different of our nonprofits. And then when we get into the elementary schools, we have a Food for Kids backpack program at 68 sites right now across 14 school districts, where we give backpacks to students every single Friday so that they can eat on Saturday and Sunday. These are typically the students who are on the free and reduced price meals for lunch and breakfast, but they might otherwise go without food on the weekend. We have also started up a middle and high school food program that we're calling On the Go. This was named by the students because once you hit, 6th grade, you're a little too cool for a backpack of food for the weekend. So we went and had focus groups with some middle and high schoolers, and they named it On the Go. And they wanted more of a pantry style where they could go in and choose the foods that were right for them and choose the snacks and choose whatever meals they wanted, rather than it being a pre-packaged bag that came for them every Friday. For all of our food distributions, they are free of charge. And then most of them don't even require any information on income. And if there is information required on income, it's a self-certification. So they just ask, do you meet the income requirements? If the family says yes, it's just believed. They don't have to provide any supporting documents like bank statements or pay stubs or anything to make sure that they can get the food they need to feed their families. But we have a great website at sandiegofoodbank.org/get help. And that is an interactive map where you can plug in your zip code or plug in what day of the week that you need food. And then you can navigate that map. It's really user friendly. But if you don't have access to the internet, you can also pick up the phone and call 211 or call our staff at the food bank front desk, and we can resource out to the food distribution in the community nearest you. So how can you as Junior League get involved? Hosting a food drive is one way to get involved. So we all have different social spheres of influence, and you might have children in school. You might go to a church where you can run a food drive. You might have an office building where you can collect food, but we make it really easy. You can host your food drive just by going on our website. We can bring barrels out to your school, church, or business. And then you tell us how long you want those barrels there to collect the food, and we schedule a pickup as well. So all you need to do is promote it to your social network and your coworkers to drop that food off in the barrel, and then we pick it up at the end. We end up date checking everything, quality checking everything, so anything can go in the barrel, and then we sort it out at the food bank in the warehouse. For people who don't want to do that physical food drive or who might be working remotely right now, we also have the option of a virtual food drive. So you can set up a web page specifically for your business or your school or your church. And then it's all virtual. People scan food items, and it goes through this digital scan, and then it's dollars that get donated. And they can do it through their credit card, or they can mail in a check. And then that can be a virtual food drive campaign where you're not actually collecting cans, but you're collecting dollars. If you have time on your hands and you are willing to come in and volunteer with us, we have a great website, and it is at sandiegofoodbank.org/volunteer. You can sign up as a group or individual. And so once you sign up, you create a profile. We need things like your emergency contact if something were to happen. And then also a volunteer waiver that you sign. Once you get that set up, you can go on our website and pick which shifts are right for you. We have shifts in our warehouses in Miramar and Vista, on Monday through Saturday, morning, afternoon, and evening. And so you pick which matches with your schedule and you sign up for it. You show up. Once you show up, you get an orientation and training, and then you get to work for the day. And it could be packing boxes for our seniors or backpacks for our elementary schools. You might be sorting through fresh produce and bagging that up for a distribution, or you might be sorting through dates on cans and quality checking cans to make sure those food donations come through. But as I mentioned, there's 35,000 volunteers that come through our doors every year. So we always need new people coming in to learn what we do and to get engaged and get involved. You can also donate money. So as I mentioned, food drives dropped in 2020 and the financial donations from the community came in huge. For every dollar donated at the food bank, we can leverage cheaper prices on the market, and we can provide 5 meals for every dollar that's donated. We're part of a co-op buying with all 58 food banks across California, and we purchase produce together in kind of a co-op model, and we're able to purchase produce at 12 to 13 cents per pound. So that's a lot cheaper than what somebody might be able to go out on a retail price and get and then donate to us. So dollars go a long way with food bank. Another way to get involved, if you're looking for work, we have 3 different job opportunities available on our website right now. A director of corporate and community partnerships, so in our development and fundraising team. We have a feed coordinator on my programs team who's out helping to implement a database in the community, as well as a warehouse picker. So somebody who's picking orders in the warehouse and physically moving the food around. So whatever your skill set is, or if you know anyone looking for work, tell them to check out the food bank website and apply, because our team is constantly expanding to help meet the needs in the community. And I wanted to touch a little bit on state budget and policy priorities that are a focus for the food bank right now. We really align with California Association of Food Banks. As I mentioned, there's 58 food banks, 1 in every county across the state of California. Some counties have 2 and some food banks share 2 counties. But we align with California Association of Food Banks because our collective voice makes a huge difference on state policy and budgets. So you can check out California Association of Food Banks website to keep abreast of the policies that we are positioning ourselves with. The current things that we have done in the last 2 years and successes that we've had statewide as a coalition is we've brought $75 million in emergency food boxes during COVID, when a lot of food banks at the beginning of the pandemic struggled to get in volunteers. These food boxes came in very key to helping continue to meet the need. It allowed us to just quickly get the box right from California Association of Food Banks and distribute it out into the community without a lot of the warehouse infrastructure and volunteer infrastructure, as we were figuring out how to keep people 6 foot socially distanced and safe in our warehouses. We also recently got $25 million in capacity grants, and this has been huge for food banks to build efficiencies in assembly lines, expand space where they need to, and also purchase more trucks and infrastructure to help build up to the capacity to meet the increased demand. Back in 2019, there was a CalFresh expansion that improved CalFresh access for those who are receiving SSI, Social Security income. And then also during the pandemic, a huge win was something called PEBT, or Pandemic Electronic Benefits Transfer. This brought $1.4 billion in federal and state funding to children across across California. There were similar programs across the nation under different names. But what this was is that typically students might get free and reduced price breakfast and lunch. But in 2020, at least all of the schools in our county went remote. And so that meant those kids couldn't pick up their breakfast and lunch in the school cafeteria. And so what our state did was did an amazing little card that went out to the families, and each family got $356 for the first, the pandemic shut down in March. So March, April, May, June. The equivalent of what they would have gotten in school meals was $356. So families on that free and reduced price meal program got that dollar benefit, and then they got re-upped benefits in the summer. If schools are closing, they're able to access additional dollar benefits for those missed meals in the school. So huge win across the nation. And I went into that one a little bit more because there's a legislative bill in the Senate right now Senate Bill 364, and it's called Boost. And this is a program that's similar to the PEBT, but what it's helping to do is when kids go on vacation or summer vacation or schools are closed down, this is that kind of tag along bill where it's going to keep that PEBT or that benefit going to families if schools shut down or if they're out for summer. So it will help keep kids on free and reduced price breakfast and lunch fed on school breaks. And something we are also really tracking right now is Senate Bill 641. And this is going to improve CalFresh access for college students. So hunger is something that's always existed among college students. I remember eating ramen myself to help make ends meet when I had to buy a lot of books in college, but the government is really picking up on this and putting in some supports to help that. It is tough for college students to qualify for CalFresh, and this bill will help streamline some of that and make it easier for students. So we are backing that right now. There is a letter that's going to the Senate Appropriations Committee, so I'll drop a link in the chat. So if your organization is able to sign on, or you as an individual want to sign on to this statewide letter, we are looking for some extra support and voices there to tell people how important CalFresh is for college students and easing that access. So my contact information here, but I will stop sharing screen and open it up to questions from the audience.
Awesome. Thank you so much, Shelley. There's so much information there. And I know that we can absolutely help with the letter and with food drives and volunteerism at the food bank. So we're working on that already. So thank you again. Let's start with the questions that are actually in the Q&A. There's a couple questions there. I don't know if you can see them. The first one is there legislation for WIC or SNAP to include diapers as part of the program?
There's not. It's always been really restricted to food. I think, governmentally, it lies in USDA, United States Department of Agriculture, for all those federal programs. So they really want to stay siloed in the food sector. I don't know if it went into if it went into diapers or non-food things. I think it would have to fall under a different department because they like to just stick with the food.
Okay, wonderful. Along the same lines, let's see. We talk a lot about obviously being junior league and maternal health, and it's awesome that you have all these programs now with 3 months ago starting the period pads and products as well. But in terms of the food, Peggy has a question here. Women are the higher amount of individuals going to food banks. Are they mothers? So are they going to feed their children?
Yes, often. Yeah, it's often the mother coming to feed the children, the family, the everyone. And not quite sure why the statistics are double females coming to the food distributions than the men, but that's really who's presenting as the food gatherer of the family, I guess, and the shopper of the family.
Okay. Because I don't want males to be forgotten, are there related issues, concerns, like the tampons that are affecting males with food insecurity, crime, imprisonment, homelessness?
As far as like stuff people need beyond food, the one thing that we get requested a lot is adult diapers, and the legislation has not opened up to that just quite yet. It's always been restricted to baby diapers, but we get men and women who are seniors all the time asking, are you guys thinking about adult diapers? Is it going to go there? And I think the answer for our state legislation is that it started in 2017 as a pilot program, and it got funded in 2018. And so Lorena Gonzalez said, let's name these 4 food banks that are going to run the diaper program. Then let's expand to more food banks. The idea right now is to focus on baby diapers and get that statewide, and then kind of expand the realm of products into adult diapers, maybe wipes, maybe formula, maybe other things to meet the needs. But I think the focus currently is we're doing the baby diapers well, and how do we make that a real statewide initiative and not just pockets of our high population cities in California.
Hi, Shelley. This is Christine. I'm just switching over from Angela. First, I wanted to say that your presentation was so great. And also, the whole time during this presentation, I was like, what about Depends? Like, are they doing adult diapers? And I'm so glad you answered that, because that was just one thing I kept thinking through the whole are one of the things I was thinking through your awesome presentation. So the next question is, what types of foods are most helpful for the food drive? It's asked by Rebecca.
Yeah, our top thing that we're always asking for is peanut butter and tuna. And the reasons behind this is it's a shelf-stable protein that is accessible to everyone. So if you're homeless, it's really easy to open a can of tuna or open a jar of peanut butter, make a sandwich. If you're a kid, peanut butter and jelly sandwiches go over really well. The shelf stableness of them is great too, right? So not all of our food pantries offer have refrigeration or freezers. So we do have some meats and some dairy and some of those other types of proteins, but not all of the pantries in the community can actually take those unless they have proper refrigeration. But peanut butter and tuna are the top things that are great across all communities and demographics, as well as like really easy to handle because it's shelf stable.
Oh, okay, so another question we have is, what's the best way for one-time volunteers to get involved with the food bank?
Yeah, so for the one-time volunteers, go to our website, sandiegofoodbank.org/volunteer. And then on there, you're going to create that volunteer profile and then pick the time and date that works best for you, as well as location, and just sign up that way.
Awesome. And then Taryn asked, is there a way that the food bank can track how the nutrition education is linked to less type 2 diabetes among other illness in the community over time? And then there's often these types of early interventions have a huge waves of impact. And I'm curious if San Diego Food Bank has been able to collect that data.
Yeah, so we have had some opportunities to get involved in some medical things and some evidence-based practice where we have like a control group and then a group that gets the intervention. But we've strayed away from those. We really want to just stay true to our mission and not necessarily chase the funding of that. We're happy to partner with hospitals who want to do that. But what we typically do is one-off virtual classes, and then we also have a couple of 6-week series classes for our nutrition education. And we think that we think our work is really important. We know our work is really important, but we also know that we are one small piece of the puzzle. So we haven't gone into any of these serious research studies because we understand that if we're working with a individual or family for 6 weeks on their nutrition, it might not be the only thing they're doing. They might also be ramping up their exercise, completely changing their diet and seeing a nutritionist. So we don't know that if we delved into this deep of research that we could actually say this change was made directly by our nutrition education. So we haven't quite gone there yet, but we are open to any opportunities. If any hospital healthcare settings or researchers want to get involved, we would be happy to. But we would also know that we are not like 100% the reason why somebody doesn't have diabetes.
And then I have a few questions. So you guys put together those like amazing grants to help get diapers and a bunch of diapers and other things. Do you guys work with other states to help them get this off the ground, or are other states already doing things that the San Diego Food Bank is doing? And how do you interact with them to help them?
Yeah, so we're a part of a couple of different nationwide coalitions. Like nationally, I would look to Food Research and Action Center. They are the ones in DC who are doing a lot of the research and putting some efficacy behind the work that we're all doing nationwide. There are 200 plus food banks across the nation that are under the Feeding America umbrella. You might have seen commercials about Feeding America, and they have like a national network based out of Wisconsin, and they are all networked. There's 184 independent food banks, so we're an independent food bank, and we are talking to each other all the time about best practices and what are you doing here in San Diego and what are you doing over there in Texas. And there's several conferences a year. They're so much better in person when you can go to another state and visit the food bank and see it. Those conferences have still gone on in a virtual capacity over the last 2 years, but I'm excited to also return to where we can actually travel again from state to state for work purposes and go out and see some of the other food banks because we learn so much from each other. And then on a statewide level, with our 2 USDA programs, we have annual best practices meeting. In 2019, we actually held both the senior food program and the emergency food assistance program annual best practices meetings at our food bank, and we showcased everything that was going on. I would say modestly that San Diego Food Bank is one of the best in the state and is looked to as one of the innovators in leading what we're doing. And that's why the state had us hold that best practices meetings in 2019. So I think part of it being such a populated 3 million people in our community, such a robust food bank, we're independent, so we're really nimble and flexible and able to do what we need to meet the community needs. So we're looked at as a thought leader, but we also always learn from others when we visit them or talk to them on the phone about what's going on. I would say early on in the pandemic, it was such a breath of fresh air to be able to reach out to my friends at other food banks and say, what's going on in your community? How are you handling this? Well, we're doing drive-through, but our traffic's backing up. What have you done about this? Or it's just great. I have, people that I text on a regular basis that are out of state and in state, especially when things are happening like a pandemic, and we are all in this together and trying to figure it out.
Gosh, every time you go on it, I have more questions to ask. We have 2 more. If there's any other questions, you guys can put them in the chat. With state, do you guys also do international work too? Maybe working with food banks in Tijuana?
So we haven't. The way the IRS is set up, our food is really restricted to being in San Diego County. We can't even delve up into Riverside or Imperial. A group of our coworkers went down to the Tijuana Food Bank, and it was so incredibly fascinating how they operate. There's obviously different regulations in Mexico. And one of the most innovative things that I love that they were doing that we would love to do here, but it would never pass our County Department of Environmental Health regulations. Any dairy that they get at the Tijuana Food Bank, they don't distribute. So they're getting in milks and yogurts and cheeses and everything else. They take it and process it into cotija cheese. And then they take that little brick of cotija cheese and pop it in the freezer. And now that cheese has another 6 months of shelf life, which is incredible because oftentimes we'll get donations of milk and it's already at or one day past that Best Buy date. And we know it has 2 more weeks, right? But now I have it at the food bank in Miramar. I need to get it to, the food pantry in Chula Vista, and then the food pantry needs to get it to the family. And now the family has 2 days to drink a gallon of milk because that's all that's left on the shelf life. So I love what Tijuana is doing with the cheese and extending the shelf life on products. We're trying to be more innovative in San Diego doing that with groups like Kitchens for Good or Oceanside Kitchen Collaborative. They will take some of our tomatoes that are not so pretty and people wouldn't eat them, and they'll turn them into salsas or tomato sauce. So we're doing some of that stuff. The regulations behind dairy and cheese is pretty strict. I think that there's not even in the county, even a retail cheese manufacturer. The licensing in our county is pretty tough to get through. So we like Tijuana Food Bank and we've been there, but there's not so there's thought exchange, right? But there's not necessarily food exchange across the border.
Oh, how interesting. And then a lot of what you talked about were goals of the San Diego Food Bank, but are there any goals that you personally would really like to or you hope to accomplish with working at the San Diego Food Bank, or what you would like to see pushed forward more?
Yeah, so prior to my 7 years at the food bank, I worked for Jewish Family Service for 7 years. And there I was able to grow a food pantry that was serving about 800 families a month to a food pantry serving 3,000 a month. So moving over to the San Diego Food Bank, I saw kind of my expertise and what I had learned there. With 500 nonprofit partners, my daily goal is to help lift them up and help them achieve as much as they can and increase their capacity. Lots of times we're working with maybe a ministry at a church or some kind of side adjunct program of a social service agency that doesn't always get the attention of the organization as a whole. So, so many of our pantry partners have 0 paid staff, 100% volunteers who are using their personal vehicles and their own gas money to go out and pick up food at grocery stores and hand it out to the community. So they have absolutely 0 budget in their program. So I think one of my passions is really helping to build those programs into something a little bit more robust and sustainable, helping them to write grants. It's been a huge opportunity in the last 2 years to have leadership, okay, $2 million in capacity funding to our partners. And we didn't just like hand out checks. We did an actual RFP process. It was a simplified one, but we wanted to use it as that educational opportunity as well for the pantries to have to write a proposal for an RFP and have to submit that and have to know that they're going to be graded on it and have to get feedback on it. And so while we were very, I guess, nice and lenient on the grant proposals that came in because we know the programs because we work with them every day, we also gave them feedback on what their proposals were and said, you're a really great writer, you should start applying for the Safeway grant, or you should start applying for this. Or those who didn't write really great, we even would go in and make line item edits and say, yes, we're going to give you the funding, but here's some edits that you need to make to your proposals going forward, and we would like to help you. And so if you write a grant proposal for Safeway, don't submit it, send it to us first and let us edit it before it goes in so that you can be successful in it. So that's just one example. We also talk to our partners about board leadership and just getting more efficient distributions. And in the past 2 years, really focused on safety and public health as well, helping them to build drive-through distributions and everything else.
Wow, that's awesome. Alex, is there any other questions coming in or any other questions that we want to ask?
Yes, actually. Hi, sorry, I still have a Christmas background on. Thank you so much, Shelley, for all your information. I was just hoping that you could touch a little bit more on CalFresh and sort of what San Diego Food Bank is doing to help promote CalFresh and what we can do as community members in San Diego. I see that you put the link on Google Doc for a letter we can sign. What else is there that we can do just as members of the community, members of Junior League, to help get involved with these types of things, CalFresh specifically?
Great question. So a little background, CalFresh was called food stamps back in the day. Food stamps had a very negative stigma to it. And so 15 years ago or so, it got rebranded as CalFresh. It's called SNAP across the nation, Supplemental Nutrition Assistance Program. But in California, we love our egos and we love to be called Cal something, Medi-Cal, CalFresh, whatever we can rebrand as Cal something. So CalFresh is a federal public benefit where people get money in a card for food. There have been some huge wins during the pandemic with CalFresh. So a lot easier to get CalFresh and better benefits. So typically pre-pandemic, somebody getting CalFresh in a household of one would get anywhere from $16 to $240 in benefits, depending on their income and their expenses. And so at the beginning of the pandemic, our state did put in some extra money and an extra waiver and got that boosted to $240 for all. And that just kind of goes up if you have a household of 2 or a household of 3. It's been amazing because $240 a month is a lot going towards food, whereas $16 a month, some people don't find it worth the paperwork to even apply for that program. So that's been something huge. Anything that comes along that we can advocate for that to continue is great. Right now it's on a month-to-month basis at our state. And so if it comes down to like a public vote, it would be great to have some backing behind that. Another huge waiver that's happened during the pandemic is a waiver for county interviews. So to tell you a little bit about the process, I've done my own taxes on paper and I've done a CalFresh application, and hands down, any day I'd rather help somebody with their taxes over CalFresh. The application is 28 pages long and you have to write your name and all your family's members' names 3 times and birth dates throughout it. It's crazy complex, and if you miss one I or T or don't cross one T, it gets rejected. You have to submit different verifications of your income, of identities with all the adult household members. I think a huge thing Junior League could do is public messaging, right, on social media and among friends. So during the previous federal administration, there were a lot of threats out there for public charge, and that families with mixed immigration status might be deported if they apply for it. And the truth of the matter is, even if somebody who is an adult in the household isn't a citizen of the US, but maybe their kids are citizens, the family can apply all together and get that benefit for the children. And that is something that's deserved and something that's earned and something that's needed for the kids. But there's some fear out there, still a lot of fear, that somebody might get deported if they apply for this benefit. So if you have friends or family members who might need this benefit, talking them through that it's okay to get it, it's safe to get it now. It's hard to repeal those myths that have been ingrained in people. And the other thing is just, there's, even though it's rebranded, there's a stigma behind it, right? At the early beginning of the pandemic, my esthetician, our salon closed down. And so she texted me on the side and she's like, what is this CalFresh thing? Can I get it? Do I have to pay it back? And it's hard to ask for help. It's really hard to reach out and ask for help. And what we all need to remember is we are working adults and we've paid our taxes, and that tax goes into this benefit, this safety net, so that it's there when you need it. And sometimes people think, well, if I get this benefit, somebody else might go hungry. But the truth is, you paid your taxes. This is an earned benefit that you have paid into, and that's there as a safety net for you. And you're not going to go without, or you're not going to make somebody else go without because you take the money. In fact, there's hundreds of millions of dollars left on the federal table, people not getting this benefit. So it helps our local economy in San Diego, bringing money into grocers and growers and truck drivers. All of this is part of the food system. And if we're leaving these dollars in Washington and going unused, that money's not coming into our local economy. So if somebody might benefit from CalFresh, be that ear for them and talk them through that it's there for them and it's a benefit. And if it's too hard because your taxes are hard and your CalFresh application is hard, reach out to the San Diego Food Bank. I have 2 full-time staff, and all they do 40 hours a week is help people with the application. They talk them through what the benefits are. They can sit there and talk them through any of the fears of deportation or public charge. They answer all of their questions. They're incredibly patient. They both sit next to me in cubicles, and I've heard them, talk to the same client 11 times in a different way to try and convince them of something and to try and convince them that it's safe. And they are just so incredibly patient. And they do great follow-up too. So once you submit the application and then the county says, well, I need this ID and I need verification of your medication expenses and all these other things, we get busy. We're busy as people and we forget to submit those things. And my staff will call you, will text you, will email you, will do whatever you've asked as your primary mode of communication to make sure that you get that application complete. Once you submit the application, the county kind of starts a ticking time of 30 days. And if you get all your stuff in within 30 days, great, you get the benefit. If you don't get it within 30 days, you have a leeway of another 30 days, but that application time starts over. If you don't make all your stuff within 60 days, you got to start all over again. So my staff is pretty amazing and gentle, but really ruthless when it comes to getting in those verifications within the 60 days. They will call you daily or text you daily if that's what it takes to help you be successful and get the CalFresh benefits. So help your friends or family members understand that it's open to them and they should take advantage of the benefit.
That's great. Thank you so much for that information. We have a few more questions. Rebecca asked, how do you address at the food bank dietary needs, preferences such as diabetic, vegan, gluten, etc.?
Yeah, so at the food bank, we have what we call a food center, and it looks like Costco, and our nonprofit partners come in and shop for the things that they need. So if Catholic Charities is coming in and they have 25 gluten-free clients, they'll come through and shop for the items that are gluten-free. And they can really tailor things to the cultural preferences or dietary preferences of the clients that they're serving. So we make it really a pick and choose model.
Great. We have another question. Does the food bank have social media blurbs we can use?
Yes, absolutely. So like us on Facebook, Twitter, Instagram, and then just share our content. So we don't necessarily put out like a media toolkit for anyone, but anything that you see coming through our newsfeed, we love you to share further and further out into your social networks.
And you guys keep that up to date pretty regularly?
Yes, yeah, yep, several
Great.
posts a day, maybe
Oh,
to the point of
fantastic.
annoying at some points.
Awesome. I think that's all the questions we have in our Q&A. Christina, did you have any other questions you wanted to follow up on?
I think we've covered most of them. I think Shelley's presentation was so thorough and so great. I think everyone thought it was amazing.
Shelley, is there any way that we can get this slide deck from you to be able to pass it along to the members of Junior League? And then we've also got several students here from UCSD that I think would want to have access to these slides. Is this something that you could send us?
Yep, absolutely.
Okay, perfect. We'll pass it along to everybody that's in attendance this evening. Thank you so much for being here tonight, for presenting this amazing content. I know I learned a lot. I think everybody learned a lot here. And we look forward to working with the San Diego Food Bank. It sounds like we're going to be working more with you guys, as our new focus area for the next few years is food insecurity and tackling that in San Diego. So this is really helpful for all of us. We're all learning more and more about these issues. So we really appreciate it. Thank you.
Thanks so much for having me. It was such a pleasure, and we're so excited to connect more with Junior League and in donating, hosting food drives, and then that hands-on volunteering in our warehouses.
Awesome. Thank you so much. Thank you. All right. Bye, everybody.